I guess the details that kind of make you more excited about becoming an EMT. Lifespan development is actually very, very important for being able to communicate with your patient across, all ages. So, lifespan development for EMTs in the very beginning, years ago when they first developed the curriculum, it wasn't nearly as extensive as it is right now. It was basically, there were 3 different age groups. There were children, there were adults, and there were elderly people, and that was pretty much it. And we didn't really get into all the details as far as, what the differences were between all the ages. And it was kind of not really that great of a thing because we'd get providers out there that weren't very in touch with how to communicate with their patients. And even since, I've gone through the EMT program, and since they updated the curriculum in 2009, there have been some even more extensive changes where they're actually breaking down the groups a little bit so that it makes more sense. So the reason, and again, one of the biggest reasons why we teach this is because people have such a difficult time relating to people, and being able to give a good patient interview and being able to communicate with your patient is, aside from saving their life when they're unconscious, probably the most important thing that you could do. So let's go ahead and get started. So lifespan development, we start with infancy. Now, again, like I said before I get into the meat of this slide, or these slides, you have 4 age groups that you're going to be tested on. Apologize, I'll have to say that's 3 again. The first age group is going to be infants, and infants are considered to be from 1 month to 1 year of age. Then you also have the neonates, which are those which are basically from birth to age 1. And don't forget your preemies, but usually, those are the ones that are born before they're supposed to be. And then you have children who are usually ages 1 through adolescence in a medical sense. Now, in a legal sense, that goes to, age 18, and in some places, you don't get all your rights until you're 21. So that's children, and then beyond that would be adults. So your 3 sections generally is, infant, children, and adult. And that was basically all we used to really need to know. But now, again, we're breaking it down more. So starting with neonates, just told you what the term is. So neonate is, a child from birth to 1 year of age. And then you have certain vital signs that you're looking at. So at birth, the respiratory rate is going to be anywhere between 40 and 60 breaths per minute. Your tidal volume is not going to be nearly what it is even a couple months later, and the heart rate is very, very fast. So if you ever do any time in a pediatric center and you end up witnessing, which is a horrible thing to have to do, a neonatal code, or if you have to work a neonatal code in the field, you'll notice that the compressions are a lot faster than they would be for a child. And that's just because, the heart is beating a lot faster, so there's, basically more of a need for that blood to be pumped faster throughout the body. And then you have an average systolic pressure of 70. That's pretty low. Let's see if I can go to the next slide here. Okay. Well, by 1 year of age, things tend to slow down quite a bit. You have a respiratory rate that's about 20 to 30 breaths a minute. So if you think about that, that's, 1 breath every 2 to 3 seconds. Still kind of fast, but not fast for kids. And you really want to remember that. You want to remember these differences when you're assessing a child. Don't freak out when you have a kid that's breathing at, 30, 35 times a minute. That may be normal for them. There's more precise calculators that, we're going to go into and those sorts of things when you get farther in depth into the pediatric section. But just remember that they do breathe a lot faster, and the heart beats a lot faster too. You can see here, they're beating at about 120 times a minute, and then the blood pressure goes up a little bit, and that's about 90. So, and again, we'll talk a little bit more about this when you guys get into the baseline vital signs sections. Do you guys have any questions? Okay. Let's discuss the physiological changes of infants. So the head is going to account for about 25% of the weight of the neonate. This is, remember, a neonate is a very newborn child, basically. So the head is huge, and basically what happens is, they start to drop some weight after the first couple weeks, and then they gain that weight. It is best for the infant to have breast milk. Formula is second best, and then once they finish with those sorts of things, or kind of going down the line, soft foods, solid foods, and then they get their primary teeth. But for the physiological changes, again, the airways of the infants are shorter, narrower, less stable, and more easily obstructed. So basically, you have to remember, because they have that big head, they have that big airway, and that big airway makes it more difficult or a small airway rather, that small airway makes it more difficult to manage because everything is out of whack. So infants primarily tend to breathe out of their nose, and the lung tissue is more fragile, prone to trauma, those sorts of things. And you can read these slides as I'm reading them. But the other thing to remember too is the fontanelles of the head, and or the fontanelle of the head. If you guys have gone over the anatomy and physiology in depth, you'll know that when an infant is born, there's a little depression in the skull, and that depression in the skull does not become fully formed until they grow. And the reason is because infants, well, I don't know if there's a reason, but always tends to be that there's some sort of a purpose or a reason for physiological structures, just in general. But again, I think one of the reasons tends to be that kids do tend to fall, and infants tend to fall and hit their heads probably more often than adults do. I mean, it's more weightier. It's unfortunate, but it does occur. And so when they hit the ground, it doesn't cause as much damage as it would as if they were an adult or an elderly person. And just basically that will close up over time. So most of the neonates' immunity, if we're talking about immune system, arises from antibodies received through the placenta. So, coming from the mother, and then their immunity is retained through the first 6 months of life as long as breastfeeding continues. That's why it's important, if the mother can, to breastfeed the child. And childhood immunizations, should obviously begin, or immunizations begin after birth. Infants have reflexes, or instantaneous involuntary movements. So, if you'll look in your pediatric section, we'll go over something called the Babinski reflex. That's basically, a choice, not an involuntary movement, I guess, that occurs in an infant. And so you'll be able to see kind of what their neurostatus is if you're using that assessment tool. But again, we'll go over that later. You have well-fixed extremities that move equally when stimulated. Don't know exactly what that means. And we talked about the fontanelles a little bit just a second ago. They should not be pressed, but they will be depressed if the child's dehydrated. And the reason being is because there's a lot of fluid in that particular space that protects and insulates your brain from being damaged during a head injury. And if the fontanelles are depressed, you'll see that there's an issue with, possibly some dehydration. Also, bones do grow throughout infancy, so you should know what activities are normal for infants and those sorts of things, which we'll go over a little bit. And let's see. Okay, good. All right, so psychosocial changes. Well, what are psychosocial changes, first of all? Psychosocial changes are, changes that occur in a person's interaction with other people. Sort of a psychology that we've developed over time, from those psychologists and adapted their methods to our presentations. Most infants, if we talk about infants, they're not gonna be very happy when you try to take them away from their caregivers. Usually, the mother is going to be the primary caregiver, and so it's going to be more difficult to take a child away from their mother than it is going to be to take them away from somebody else. And that's just normal across the board. So if those sorts of things are happening, you just need to know why. Why is this child crying when I try to pick them up? It's not because they don't like you. It's just because that's normal. And I think a lot of times providers will get freaked out, when they think that a child is acting or crying or acting in an inappropriate manner when they're not really. That's just normal for their age group. It's difficult when you don't have children also to be able to really completely relate to this. And not having children, when I first got into the field, unfortunately, I hate to say that, but it's just simply true. The more familiar you are with something, the easier it is to assess it. And in this case, the more familiar you are with children, the easier it's going to be for you to assess them and identify with them. But the most important thing is to remain calm when you're dealing with children, because children really, although there are some differences, we're all very similar. So, an emergency for an infant is just as easily managed if you're competent as an emergency for an adult. If an infant does not seem upset when they're separated from the parent, just think about what the underlying causes might be. It could be that they don't have a very close relationship with that particular parent, or it could be that they are sick. They're not feeling good. They're totally down. Infants communicate all of their needs by crying. I wouldn't necessarily say all, but a large majority of them. And so, parents will know. They'll call you and they'll say, you know what, my kid has been crying for the past 3 days and I can't get him or her to stop. And that can be a problem. And sometimes you might end up you transporting a patient just because the infant was crying for a long time. And, maybe they'll go into the hospital and find something. Sometimes it's not necessarily our job to completely diagnose every injury or illness while we're on scene, but just to provide supportive care to the family. Some crying can be avoided if the parent's allowed to hold the infant during assessment. That is very, very helpful. If you can get the mother or father to hold the child and participate in the assessment process, it is going to make that assessment process 1,000,000 times easier. I promise you. Once you separate the child from the parent, it is going to make it extremely difficult for you to do your job, unless the child is unconscious. And you have to remember, how much damage are you going to be doing to a child if you move them away from their parent? I mean, I'm not necessarily talking just in an emotional sense, but I'm also talking about in a physical sense. When you get to the sections where you discuss spinal immobilization, or where you get to the sections where you're discussing, certain types of treatments and those sorts of things, you really need to watch out for what's going to happen or what could possibly happen if you separate the child from the parent. So by the end of infancy, a favorite toy might calm the child down. And this is another psychological thing that tends to occur. Calming voice also helps. So, if you're running around acting crazy, that's not really helping them out. It doesn't help the parents out. It doesn't help anybody out. So just try to remain calm. And now we're going to talk about toddlers. And I know it is almost 7:30, so if you do need to go, you are certainly welcome to do that. If you'd like to stick around, now we're going from infants and then to toddlers. So these are from 1 to 3. A preschool is preschoolers from 3 to 6. So if you think of toddler, think of, terrible twos and lots of crying and diaper changing and those sorts of things. Those are some fun years. Heart and respiratory rates tend to decrease as child ages. So just like we talked about with the infant and the neonate, as they get a little bit older, you're going to see these values change. And again, heart and respiratory rates decrease as the child ages. Systolic pressure increases as the child ages. So the heart's going to beat slower. The lungs are going to go, they're going to take in and out air slower, and the blood pressure is going to get higher. That's because their heart's getting stronger. We have physical structural changes. So the bones and skeletal system continues to grow. Children, they'll have their primary teeth by the end of this period, and muscle mass starts increasing. So your respiratory system or your pulmonary system, your lungs are going to start getting a little bit bigger and branching out. So everything is growing. Immune system's getting stronger, and the immune system is starting to really develop on its own. The nervous system. The brain is the fastest growing part of the body, and this is where you're really going to have a lot of independent changes occur in the toddler. These are some serious formative years where things are going to change. So you really want to make sure that if you're assessing them, that you're doing it in an appropriate manner. It says it's important for you to recognize that they're what they're capable of doing. So, don't talk to a toddler like you would talk to an infant, and don't talk to a toddler like you would talk to, a teenager. And I've seen it before. I've seen people talk to kids of this age that way, and they just don't get it. So try not to use complicated words. I would say that in general, when you're talking to a patient, do everything you possibly can to break it down, unless, for some reason they know, or some reason that they're on your level. The toddler psychosocial changes. So, language is starting to take the place of crying, which is good. So now we can communicate with them a little bit better. But then we have a little bit more separation anxiety that's expressed a little bit louder. And, toddlers can be very, very loud. So you really want to be careful at this point. Parents tend to be very reactive towards that, towards their crying or towards their yelling. And you can really see a situation, you can see a scene just completely devolve because of the fact that there's not a good interaction between the provider and the child. Case in point, it's a very good one, IV administration. If you were trying to do an IV on a toddler, so again, from ages 1 to 3, the toddler doesn't understand the reason why you're trying to give them an IV. They don't know what's happening. If you are at the point where you need to give this toddler an IV, they really need to be in a situation where they need that IV. And again, as an EMT, you may or may not be giving IVs. It's unlikely that you'll be giving an IV in this type of a situation. Usually a paramedic would do that, but it is possible. But again, I'm just giving you this example, although it may be above your scope, so that you can see what would happen in this situation. And you know, even putting an oxygen mask is quite similar to what could happen here. So, you know, you're going to try to give them an IV. The kid's going to start screaming the second he sees the needle. The parent is going to look at you and say, "What are you doing?" They're going to freak out, and before you know it, you've lost all trust from not only the toddler, but also the mother, the father, and whoever else is present, and maybe even some of the providers. So you really need to treat this in a delicate manner. You know, and those are some things that we might not necessarily be able to teach you, but they are some things that you should be aware of that can occur. So just think about these things. How are you going to deal with this situation? I can tell you that the most important thing that you can do in this circumstance is to communicate the reasons why you need to do these things to both the mother and to the child. Keep an open line of communication, open dialogue as much as you possibly can with everyone. Let them know what's going on, because the second that you go into the zone, you go into tunnel vision, whatever, and you're not paying attention to what happens, is the second that that entire scene breaks apart. And they break apart so often when you're talking about kids of this age group. So by age 5, a preschooler can say their name, address, and recall stories and tell stories. Now again, this isn't always fixed. Some preschoolers can, some preschoolers can't. I've got 2 that can, I've got 1 that can't. Now they could say their names. The address is a different story. Children can play simple games. They can follow basic rules, of course. You know, they should be starting to develop some relationships. Again, communicate with a child at the child's level. So you may not be able to say this is an IV, but I'm going to be giving you some medication here, or I'm going to be, I'm going to put an oxygen mask on you, and they're not going to know what that is. So you're going to have to really break it down. You'll have to say, we need to give you this so that it makes you feel better. And, hopefully the mother or the father can help to support your treatment in this case. The school-age children are a little bit older, so 6 to 12. We're talking first grade through middle school. Well, before middle school. Vital signs, again, you're seeing the heart rates are decreasing, respiratory rates are decreasing, the blood pressure is increasing. Their bone increases in density and size. Primary teeth are now replaced with the permanent teeth. So when we say primary teeth, that means first. So the first teeth. Well, we call them baby teeth. And then the brain function increases, and some children struggle with nocturnal enuresis. I am guessing that's wetting the bed sometimes. Correct me if I'm wrong. Does anybody know what that is? Okay. Looks like I got it. Thanks, Tony. And see, that's another thing that's good about your anatomy and physiology, is that you can really break down, what these words mean. So, nocturnal, obviously night, and then enuresis. Well, when I looked at the word nocturnal, night, that's pretty obvious. But then enuresis, well, uresis looks like something having to do with a urinary system or urine, and there you have it. Any questions? Okay. Uresis. Okay. Like I'll just take your word for it, Robin. Okay, so ages 6 to 12, again, tends to be my favorite age group, and just because of the fact that they're intelligible, but they are they're not hormonal yet, and so that's makes it a little bit easier to communicate with them in many ways, because at least you have a lot more honesty. But in any event, they develop relationships outside the home. They have some social activities that are going on, and they can really communicate with you in a reasonable way. As long as you break it down, you should be able to communicate with any child that's 6 to 12 pretty easily. They develop a sense of self-concept. They have their own self-esteem, and they're getting their morals. My wife always says that she went to school and got her degree in it's not education, it's early childhood. But she always says that by age 5, your kids are pretty much raised. So that's pretty much about how they're going to be when they're adults. And you kind of see that because these little personalities start developing, at about 6, 7, 8. And things seem to remain fairly consistent. And unless there's some kind of ridiculous trauma that happens in someone's life, after that age, their personality generally tends to stay about the same. But again, these kids, they understand pain, illness, death, and loss, and they do identify with you guys, when you get out there as EMTs or firefighters or police officers who can help people. So this is a good thing. It works to your benefit. Again, they can still break down to that toddler mentality type, especially in a critical situation. So it is always important to communicate with them, and also to communicate with their parents as well. So I want to talk about this just a little bit before we get off this slide. How do you communicate with somebody who's age 6 to 12? You communicate to them in a way that's respectful to them, and you don't talk just to their parents. I've seen providers talk to just their parents at this age group. This is bad. They need to be a part of the treatment process as well. Now, granted, they're not necessarily making their own decisions for what they want and what they don't want, but it will make your life a whole lot easier if you establish rapport with both the child and the parent. Very important. So the next thing is adolescence. And so this is obviously a very difficult age in a psychosocial sense. As a provider, you're going to run into some interesting situations or scenarios with this age group. Get eye level. Don't lie. Oh yes, get eye level. That's right, Tony. Gosh, how could I forget? So whenever you are assessing any kind of a patient, no matter what the age group, now it's probably a little bit different with infants, make sure that you are at eye level with that patient. Do not tower over kids. Do not tower over, adults. Don't tower over anyone, because that right there is the first thing that will destroy your entire patient interview. You need to be at their level. Watch their body language. Yeah, exactly. Watch their body language. And Tony says, what did you say? Watch your body language. Hands on the hips make you look larger and intimidating like a cobra. And Robin says, I will squat a bit for shorter people. You know, it sounds funny, but it's true. You should be doing that. So you need to be at their eye level. Just think about the things, just think about how frustrating it would be for you as a patient to have somebody towering over you, you know, while you're in your moment of crisis. Tony says, try to sit down next to them. Exactly. So these things are very, very important to do. So again, adolescents, are we saying to do this with adolescents as well, Robin asks. Yes, we are. We're saying to do this with everyone. We want to be about eye level with them. So if that means that we need to, or take a knee. Yeah, right. Exactly. And that doesn't mean lay on the bed right next to them or anything like that. No, it means be eye level with them. Yeah. Oh, I can see how fast this conversation can could devolve. Yeah, no, we really want to make sure that we have established this good rapport with them and that they feel comfortable with us. Maybe not that comfortable, but you get the drift. Okay, so all right, an adolescent is between 12 and 18 years of age. I would argue it probably goes on a little bit farther than that, but you know, that's just how it goes. Maybe till 25, maybe a little later. It just really depends on the person. Vital signs, again, we are looking at decreases in vital signs, and we are looking, at respiratory rates and decreases in heart rates, and then increases in the blood pressure. So just remember, you know, throughout the ages, these things remain fairly consistent. Respiratory rate gets lower, heart rate gets lower, and blood pressure gets a little bit higher. Physiological changes. So you're going to see a huge growth spurt here, you know, just in general. And one of the things in females, at least, that causes this growth spurt is the menstruation. So once a female begins to menstruate, excuse me, not, let me go back to that. It's weight. So if they are heavier, if a female is heavier, she'll menstruate earlier, which means that she will have a huge growth spurt earlier and experience adolescence sooner. So that's why, you know, you'll have 10-year-olds that have you know, started their period and now they're adolescents because, you know, they were very heavy and for whatever reason the weight seems to trigger that. Adolescents do go through puberty. Okay, so sexual organs mature. Yeah, exactly, Shannon. You experience changes that cause family conflicts, most revolving around adolescents and their parents. So, you know, I mean, they're trying to assert themselves. They want their individuality. They're testing boundaries. And let me tell you something. This testing of boundaries does not start at adolescence. It starts at birth. It's just that they look so much more like adults that people are more interactive and receptive to the fact that these people are just becoming individuals and going to be able to pick and choose their own path or destiny. And there could be something, there can be something that changes, you know, when the hormones kick in. You know, it does change chemicals in the body. Tony says, when assessing girls of childbearing age, they all can be pregnant. In the words of Dr. House, people lie. Right. So what does that mean? Well, it is an irritating question for a female to get asked, is there a chance you could be pregnant? So the reason, what I would suggest that you do in this case is remember that it is important to be receptive to their feelings. But also remember the reason why you're asking this question. You are asking this question because you want to make sure that they are not pregnant. Because if you miss that as an assessment or as a diagnostic, you're screwed. You can be found liable if you miss that. So, and you know, we could go on to the past or the reasons why that might be the case, but that is something that you want to make sure that you get a negative answer for. If it's not true, and obviously if it is, then you know you get your answer. And Tony says they will lie, all of them, especially around their parents. He says you might have to get the parents out of the room or whisper to them or re-ask once the patient is in the ambulance. There's some interesting rights that are coming out now for pregnant teenagers, which I'm going to write a little note down here about that. Rights. But in any event, yeah, re-ask. You can re-ask them once they're in the ambulance. And we may be skipping a little bit ahead, so if we do end up skipping ahead, I'll disregard those sections as we get to them. Jason says he works in group homes, and the kids will never tell the truth about anything because they don't want the staff to know. What if the parents won't leave? That's a good question. You know, ask them if the cloth looks like chloroform. That's horrible, Robin. If the, oh, I'm getting a little feedback there. Hold on. Okay, so if the parents will not leave, that is a good question, Jason. If the parents won't leave, you're going to have to be very persuasive and creative about how you can get them to leave. These are some interesting situations that you might find yourself in, and you may disagree with me here. I'm just telling you what the law says. If a child is pregnant, a child being someone who's under 18, they have the right to make medical determinations regarding their child's life. Now, they can't do it without parental permission. They cannot make decisions about their own child's life without parental permission unless they get a court order to do that. This is newer law. It's past Roe versus Wade. So I don't know what the name of this case is or whatever it is that's come out that said this, but you hopefully won't be encountering this situation too often in your career. So what you're going to want to do in these types of situations is really try to get that pregnant female or the female that you suppose might be pregnant or that you're going to ask the question to away from the parents so that you can ask that question. And, you know, if you have to get your partner to distract, you know, have them go out. Tony says this also goes for drug use, smoking, drinking, and sexual activity too. You know, really, you're right. What it comes down to is that we want to make sure that we're getting the best information for our patient, and that's really the most important thing. Get the best information for the patient. Jason says HIPAA protects the children, medical staff, and cannot tell the parents. I'll tell you something right now. It doesn't matter because what we need to do is make sure that we don't get ourselves in a situation where we're disclosing information to parents when we don't have to. You have such a short trip from the scene to the hospital. Minimize your liability as much as you can. I strongly suggest do not get involved in that argument or that discussion. It just doesn't do you any good. In any event, we could go on and talk about this for hours and hours, I promise you. And again, it touches on that pro-abortion, anti-abortion talk and those sorts of things. But the most important thing to take from this entire discussion is that you are an advocate for your patient, and your patient is the most important thing to you when you are on a scene. So do everything that you possibly can to make sure that your patient's rights and interests and health are protected. When in doubt, as long as you follow those 3 principles, you should be okay and defensible. Okay, so moving on. They may participate in risky behavior or self-destructive behaviors. They want to be treated as adults. Parents' consent is required for medical treatment. Now, again, this is a test question. These are always test questions about consent. So, if you have a child, they're under 18 years of age, you need parental consent. Want privacy and may disclose more information when their parents aren't there, just like you said, Tony. They're increasing their self-conscious. They're concerned about the way they look. And then I don't know what happens when you get older, but it's like, you don't care anymore. I don't know what the deal is. But the increase in antisocial behavior peaks around the 8th or 9th grade for, kids that, aren't fitting in. And then obviously attractiveness to the opposite sex. Okay. Is there implied consent with a minor only if the parent is not there? That's an interesting question. So Jason asks, well, we call it minor consent in the medical community. So implied consent meaning that, I can basically do whatever it is that is a reasonable thing to do. Like I got disconnected. Hold on just a second.
There are 6 other callers on the call.
Okay. All right, I'm back. All right. So minor consent. You can do whatever is reasonable for the treatment of a minor. If the parents are not present. However, once you're done making and doing reasonable treatments, you need to make a reasonable attempt to contact the parents. So in practice, how this is going to happen usually is you're going to get called to the school, and you're going to have a child there, and they're going to be like 15 or 16 or whatever, and they're going to be having difficulty breathing. The nurse is going to say, I tried to contact your parents, but nobody was there. And you're basically going to treat this child as if they were your own kid, and you're going to transport them to the hospital. If they call you and it's a cut, a bruise, a scrape, something that's incredibly minor, and you don't feel needs a transport to the hospital, you need to call your medical direction and get authorization to do that refusal before you before you let them go, and basically put it all off on them. In fact, I made it a standard practice, and I would advise you to do the same. Make sure that whatever you're doing whenever you do a refusal, contact your medical direction every single time. I did it every single time. I've never been called into court for any of my refusals that, I've done as far as paperwork on our patients. Get another question here. It's kind of a long one. Goodness gracious. Oh, okay, yeah. So Tony has provided the. I hope he's listening. This is shots fired. That's right. Not any longer. Early adulthood is the stage from 20 to 40 years of age. Yeah, exactly, Tony. The next bracket. I'll be there soon to join you. Don't worry. Again, you have some changes in vital signs here. It's pretty much the same consistent that we've talked about before. Decreasing respiratory rate, decreasing heart rate, increasing blood pressure. Early adulthood physiological changes, peak physical conditions between 19 and 26 years of age. That's debatable. It just really depends on your own conditioning. If you condition yourself and you remain physically active, this can last a lot longer. After peak physical conditioning, your physical condition begins to slow, you gain weight easier, and those sorts of things. Again, that is a debatable claim about gaining weight easier. However, there's many sources that say that you do. There's more sources that say that you do than you don't, but there's some new sources out there that say that gaining weight actually remains the tendency to gain weight. The tendency to gain weight is basically the same throughout your entire life. It really just depends on your physical activities. However, I understand. Tony and Jason are saying, nope, we're in stage 3 here, and that's just how it is. Your spinal discs began to settle. What does that mean? Well, you know how we were talking a little bit before about the fontanelles and how they, fuse. This is kind of the same thing. Your spine kind of tends to settle where it's at. So it doesn't necessarily fuse, but it's not as, for lack of a better description, rubbery. And so it's going to be a whole lot easier for you to injure your back as you get older. And on that note, if you haven't already been told, the chances that you're hurting your back in the field are pretty good. So, you really want to make sure that you take care of your back when you're in the field and lift right and properly whenever you can, and always call for lift assistance. I have known many providers that have had extensive back injuries and back surgeries and those sorts of things. And granted, it's getting a lot easier now because they do have automatic gurneys and those sorts of things, but just something to think about. So early adulthood psychosocial changes, they do tend to take on more responsibility. And here's my favorite, leave parents home. I know a lot of people who are past the age of 40 who have not left home yet. So if you haven't left home, you're still in early adulthood. So just think about that. Develop romantic relationships, some of which might possibly lead to marriage. Childbirth is also common. And, because a word about stress real quick. So, because of the fact that you have all the previous psychological history, you are going to be more capable of dealing with stress than when you were younger, because it doesn't really influence you necessarily so much as it would in your formative years. The middle adulthood, we're not really seeing too much of a change here. It is from age 41 to 60. Not really much of a change, though, on the vital signs. They're actually almost the same, similar to what they are for an adult, a young adult. And then the psychological changes, and I promise you guys this will be done fairly quickly because we have a lot of repetitive information that we are going through. Adults become more susceptible to chronic illnesses. Cardiovascular health becomes a concern. All right, so you see these you see these slides, this information here. The gist of this information is that this is actually older generation stuff. Newer generations tend to be a little bit healthier than they were in the past. In the 50s, you really saw the growth of fast food restaurants, fast food chains, and they exploded in the 80s and 90s. So now, you've got some campaigns with the fast food industry to make sure that their food is more healthy. You have people being more health conscious and those sorts of things. So in healthcare is becoming a lot more supportive, with giving people and providing them with medications to prevent them from developing further illness. So yeah, Robin says don't do McDonald's. Yeah, it can happen. You can get if you're not careful, you can really put a lot of stress on the body. The cholesterol levels are going to increase, weight gain, vision changes. So there's less circulation as time goes on. And for some people, this is faster than others. You'll notice as you get older, some people just tend to just age a lot faster than other people for whatever reason that is. And there'll be people that that they were young, and then they appeared to be healthy, and then all of a sudden, in a matter of just a couple of years, they look like they're 10, 20 years older, and it just happens just like that. Hearing might decrease. Women go through menopause, and that's the end of menstruation and their fertility. Middle adulthood. So we have the psychosocial changes. This is really the age where people know who they are, and they might question where they're at in their life, and whether or not you ever heard of a midlife crisis? Well, usually that occurs in the 30s, right? But now you're seeing it happen more so in the 40s. But basically, people, they worked so hard, and now here they are in this particular point in their life, and they feel like they haven't done everything that they wanted to do. They didn't go travel like they wanted to. They didn't have all the kids they wanted to, or they didn't, do this or that or whatever. So you'll see a lot of suicides in this age group. May set new goals for the remainder of their lives, and change the way that they think about things, and also may delay seeking help for health issues. I am particularly bad about this. I will not go to the hospital unless I am dying, and you'll have to cart me away. So I don't know why that is, but that is very similar for people who are in middle adulthood. They might be burdened by financial commitments and empty nest syndrome. So like, when all the kids have gone off to college or have moved out of the house. And they might become grandparents. Some people become grandparents in the late adulthood stage, and others, well, they might become parents at this age. In any event, the heart rate, respiratory rate, and blood pressure depend on your physical status and health. It really does depend on this particular situation, or this particular age group. You're going to see a lot of different varying vital signs in this age group, and that's just basically because all the body parts are worn out. You're getting older, and so if your heart isn't working properly, well, there's a myriad of different things that can happen as a result of that. Your blood pressure can either get lower or they can get higher. And same goes for your heart rate. Same goes for your breathing. Have you been a smoker? Hey, you smoke a lot, what is that going to do to your body? Is that going to, mess with your skin? Is it going to mess with your weight? What happens when you don't take care of yourself for a really long time in a certain aspect? Does this person have diabetes? So again, we're just kind of looking at like what their medical conditions have been over the years. The maximum lifespan of the human being is 120 years. Well, that would be awesome to live to 120 years. But I think the average now is anywhere between 80 and 85 here in the U.S. I looked at a a chart recently about that, and the U.S. actually has had a very high life expectancy for the past 1 to 200 years in relation to the rest of the countries throughout the world. However, in the past 50 years, the U.S. life expectancy in relation to other countries has actually been on the decline. And I promise you that a lot of that has to do with our fast food and poor eating and dieting habits. Life expectancy is the average years of life, so remaining in their years. And cardiovascular system, blood vessels thicken, functional blood volume is decreased. And when you've gone over anatomy and physiology, you'll know how important the blood vessels are to you. Blood vessels are basically the central reason why people have strokes, heart attacks, and develop diabetes. All those three conditions are related to what happens to your blood vessels and not necessarily your heart or your brain. So just think about that. Respiratory system is weakened. Chest wall and structures, chest wall bones and structures weaken, and the elasticity of the diaphragm is diminished. Diffusion, so basically, things are just not working properly. Your brain does get smaller, and neurons are lost. This is kind of an interesting one, though. However, if you keep your brain active in the late adulthood and you keep your brain open to new ideas and those sorts of things, researchers have found that people who are in more active professions as they get older and they work when they get older don't have their brain getting smaller. In fact, it can still grow, but it's just up to you whether or not you want to go through this cycle or not. The reaction time to stimuli is increased. So basically that means that it takes you longer to feel pain. You don't feel as much pain, and you'll notice that older adults, elderly people, have a great difficulty with, or not great difficulty, but they don't experience as much pain as the younger people do. And sleep cycle might be disruptive. So, you might have somebody who's, they're getting older and they're not sleeping as much. I think the average sleeping time for somebody over 70 is about 5 to 6 hours a night. I don't know about you, but there's no way I could do that right now. Late adulthood, physiological changes. Again, everything seems to be shutting down. The high points here, the elimination of urine decreases, and I would say you just really need to be aware that these things are happening. This is your very last slide here. Wisdom is attributed to age in some cultures. Some adults in this stage are cared for by their family, and some are by themselves and are isolated. One thing you want to remember about this age group is that if you have a chronic illness, or if you have an elderly person that does have a chronic illness, many times it is very, very common for people who have been caring for them to get sick and tired of caring for them anymore. As horrible as that sounds, it seems to be the case more and more often, because we have all of these centers out there for the elderly, nursing homes, and people have just had it with taking care of their parents, and they're done with it. They don't want to do it anymore. It might make them angry. So you may go to somebody's house, and there may be an elderly person that somebody's caring for, and you just kind of notice that people are angry. This can also happen in a relationship between a husband and a wife, where one of them has developed a chronic condition where the other one has to take care of them. They become resentful a lot of times. So just notice that if you're in there and you sense some irritation, that could be what's happening. Leaving a long established home is often required. So crazy. You know, you're 70, you're 80 years old, you can't take care of yourself anymore, and here you have to go live in a really small room. You know, hopefully you can keep yourself active enough to where you don't, you know, end up being in that situation yourself. But this just tends to be one of those things that happens. You know, there's financial burdens, those sorts of things that need to be taken care of, and maybe things that, you know, family members or relatives are irritated about. And I'm only focusing on the negative, not because the negative is common, but because it is what you will most commonly see when you're in the field. So just because you see people out there that are in these situations, or even just because you see people that are out there dying, and you know, you have all this massive destruction and these sorts of things happening all the time, doesn't necessarily mean that all that stuff happens, you know, day to day for everybody else. These are very rare circumstances and situations that you'll be involved in people's lives. Independence can be given up, and again, the loss of loved ones and friends must be acknowledged. So you'll see, you know, a lot of people when they reach, you know, age 50 or greater, will be looking in the obituaries. Seems to be a very common thing as people get older. And that's it. So I do apologize that we're over time. Do you guys have any questions or anything regarding the presentation, or regarding what's happened in class?